Okay, good morning, Oli, once again. We were not able to um, engage ourselves last week. Am I right?
Yes, absolutely.
No. But were you part of the level three as well?
No, I wasn't.
Okay, okay. You're not part of the level three lectures. And so we reframing, we're trying to catch up this week on LO1. So, Olu, my name is Danny Mensah. I'm your lecturer for today. Okay. Um, we'll be looking into level 5 qualifications and a unit leading and managing of health and social care within the health sector. And this is generally the assignment brief. And when we say the assignment brief seeks to underscore or underpin what we expect learners to achieve, whether they would want to achieve a pass mark, a merit, or a distinction. And so the learning outcome, so to speak, or the assignment brief gives us an overview of what learners need to put in terms of submitting your assignment. So for instance, LO1, which seeks to look into understanding the regulatory environment for health and social care. Should you want to have a pass mark, we expect you that you should be able to explain the legislation and statutory requirements underpinning a chosen area of care in a specific national context. That is if you want to achieve a pass mark. And if you want to achieve a merit mark, then you should go further to analyze those examples of the response of organizations to inspection requirements and so on, and distinction as well. In some of the units, there's no room for distinction. You may only have a pass or a merit. Okay, but in some, you may have the room to have a distinction mark as well. So as we go through, you would understand what requires of you and what you need to do as a learner. Okay, what you need to do as a learner. And for every lecture, once we've completed all the lectures, we do what we call assignment discussion. Okay, we discuss so I can guide you and help you to achieve those marks. Okay, all right. That's assignment B. So let's start the raw lectures and then LO1 we couldn't do last week, and then we take it from there. So tell me a bit about yourself.
All right. I trained as a nursing assistant. My name is Olufumilola for full. I'm a trained nursing assistant back home in Nigeria, but
Yeah.
I came into the UK on the route of care work, which I think I can do better than just being a carer. I want to go into administration in healthcare. This is what I really like to do. I'm an admin person. You know, I've been an event planner for many years, which are not healthcare events, but I want to, combine my nursing assistant with event planning into healthcare administration. So hence enrolling in this course.
Okay. So did you say you came in as a skilled worker?
Yes, I did.
Okay. So are you based in Manchester or are you based in London?
No, I'm in Kent.
Oh, you in Kent. Okay. But you're still under sponsorship.
Yes, I am.
Oh, so that's fine.
Yeah.
That's fine.
I hope you don't mind. I have a very bad
Don't
cold.
worry. You could turn the video off there. Don't worry. Turn the video off.
All right.
Turn the video off. Okay, you can turn your video off there.
Thank you.
You're welcome. So Olu, so like I did underscore, I hope you can see the screen.
Yes, I can.
So our aim is to develop the knowledge of key concepts, theories, and models of leadership and management and how they are applied within the health and social care. We'll therefore look into how leaders in care create positive organizational culture. Learners will explore the regulatory and legislative requirements within the health and social care. Very important. Okay. If you need to ask any question, you can always draw my attention. Okay.
All right, before we go far, okay, sorry, then let me take you back quickly.
Okay.
When you were showing the assignment expectations, either pass, merit, or distinction,
Yeah.
Then my question is, if you want to go for merit, are you going to combine your pass, the way you answer your pass segment plus the merit, or you're going to answer your questions only based on what is outlined under merit?
No. So you need to be able to achieve, to be able to satisfy the pass requirement, the merit requirement, and
Oh,
the exactly and the distinction.
all right, that's what thank you.
Or the distinction. That's the only way you can get distinction.
All right, thank you.
Means that you've exceeded pass and merit. You know what I mean?
Okay.
And therefore you need to get distinction qualification.
Okay, I see. Thank you.
Good, good. Now, the regulatory requirement for health and social care in the UK is a complex and multi-faceted system designed to ensure the delivery of safe, effective, and high-quality services to the public. This environment is governed by a range of legislation, regulatory bodies, and professional standards that work together to safeguard the interests of service users and providers alike. Okay. It says the legislative framework provides the legal foundation for the regulation of health and social care. Those key pieces of legislation include the Health and Social Care Act 2022. I reckon you've heard of this before.
Yes, I have.
Okay, all right, which seeks to regulate the entire structure of the NHS in England. And when we say the NHS in England, we're talking about the entire NHS within England, because we have what we call the NHS Scotland and NHS Ireland. Okay.
Yeah.
Okay. So the Care Act 2022, it used to be the Care Act 2024. Okay. Which was revised to the Care Act 2022. Then we have the Care Act. So we spoke the Health and Social Care Act, and we have the Care Act 2014. This legislation seeks to the local authorities' duties relating to assessing people's needs. So we have what we call social care. Okay.
Right.
So what kind of care do you do, Olufomila?
Yeah. I work in a care home, and we have adults with learning disabilities.
Okay.
It's a residential place.
Oh, okay. That's fine. That's fine. So you are not supported living, you're a care home, right?
Yes.
Okay, that's fine. That's fine. So the Care Act 2024 seeks to do more of social care, because we have health care and we have social care, okay?
Okay.
Where healthcare cut across hospitals, care homes, and all that, you know what I mean?
Yeah.
But social care is more to do with the supported living kind of, okay?
Yeah.
Support living kind of working in people's homes and all that is more social care. So that deals with funding, because normally it is the service users funding that he can access with the government that will determine the amount of care the service users receive. You know what I mean?
Yeah, I do.
Exactly. Then you have the Mental Act 1983, amended by the Mental Act 2007. And this, 1 minute. This seeks to address anything that governs treatment and care of people with mental health disorders, and provides a legal framework for which assessment, treatment, and rights. So it helps in how service users will be treated as a carer or as a nurse. Okay. This acts, among others, establishes the legal requirement for health and social care providers, ensuring that the services are delivered in a manner that respects the rights and dignity of it. That is all about care. Care is all about respecting the rights and dignity of individuals, okay?
All right.
Yes, the service users first and then yourself. So in care, there's something we call person-centered care. Have you heard of it before?
Yes. Yeah.
What does it mean?
So person-centered care is giving care to your client or service user, as it were, based on their own input, how they want the care to be given.
Amazing. And that is all about care. You always have to think about their input, okay? Not to be autocratic and all that. Yes, we are there to help them.
Yeah.
However, if a patient refuses to take medication, what do you do?
Of course, if you try to tell the patient why the need to take it and is insistent, you have to let go. And as a support worker, you have to let your manager or whoever is in place of authority know about that.
100%
You
spot on.
cannot force your clients.
Spot on. Spot on. So it's more about their personal care. So they have the right to choice and right to do. All yours is to encourage the person, okay? And explain to him or her the reason why they need to take their medication. However, if they decide to refuse, there's nothing much you can do because you have to respect their choice. You write it down, you record them, isn't it?
Yes.
And then you report to your line manager or supervisor.
Yes.
Okay. And this is what we call person. It's very, very important. It's all about their choice. It's all about their privacy. It's all about what they seek to. You are there to encourage them. However, you can't impose what they don't like on them. Okay. Now, CQC, what do you know about CQC, please?
CQC, Care Quality Commission, they regulate how care is given to clients. They set rules and regulations that guide us, the providers, in provision of care to our service users.
Okay, that's true. So in the UK, whether hospital, whether care home, whether supported living, whether agency, whether small company or big company, all of that, before you can be approved to supply, even with the skilled workers, a company, okay? You ought to have a CQC approved in place. So CQC have the right to ensure that a company is fit for practice, and CQC have the right to shut down a company. You agree?
Yes, I do.
Amazing. And so in one of the requirements as an agency or a care home, you ought to have a CQC license. They'll have to come to your office, inspect your documents before they give you the green light to operate. And they do what we call yearly inspection. So CQC comes to your place and they feel you're not fit for purposes, they can advise that your company or your care home should be closed down. Okay. Then we have the NICE that provides national guidance and advice to improvements. Then we have the General Medical Council. Okay.
Yeah.
General Medical Council. Very important. What do you understand by General Medical Council?
From what I can see here, because I haven't heard about them before, is to regulate medical and nursing professionals, basically.
Yes, yeah, but not nursing, because if you realize two things have been added together, you've not paying attention.
Okay.
You look at the General Medical Council and the Nursing and Midwifery Council, MSc.
Yeah.
So the Medical Council only regulates medical doctors and consultants.
Okay.
The MSc regulates nurses, which is also the same as Nigeria and Ghana.
Yeah.
It's the same thing, the same name.
Yeah.
Okay. They regulate nurses and nursing professionals. Okay.
Yes.
While the General Medical Council regulates only medical doctors or medical professionals.
Okay.
Agreed?
Yes, agreed. Absolutely.
Good. Then we have the health professionals are required to adhere. There's another group that is not in the slides, but I'm giving it to you. It's called HCPC.
Okay. What does that
Have you
mean?
heard of it?
No, I haven't.
HCPC, that is the health of professionals. Do you want to write it down? Let me.
I'm writing already.
Okay, just one minute. Let me just. I will probably. Is the Health and Care Professionals Council.
Okay, health and care professionals.
Let me put on the message. Health and care. Health and care professional. Professional Council. HCPC. Can you see the screen?
Yes, I have seen it.
Awesome. So you can read about that, and they regulate allied health professionals. And when I say allied professional, I'm talking about dietitians. I'm talking about practitioners like ODPs. Do you know the ODPs?
You mean
therapists? Practitioner. Yeah, therapists, OPDs, all the radiographies, okay? All those professionals, when we say allied, they are regulated by the ACPs.
Right.
Occupational therapists, okay?
Physiotherapy.
All of them. Dietitian, radiographers, all those experts, they fall under the ACPs, okay?
Okay.
All right.
Thank you. Yes.
Aha.
So do we as maybe care administrators, do we fall under allied health also?
No, you don't. You don't fall under.
But they are not part of health and care, HCPC, Health and Care Professionals Council. Are they part of them?
Who? You mean who?
I mean healthcare administrators like
No,
myself.
no, healthcare, you are not part.
Okay.
Healthcare, you are not part of ACP, you are not part of any of them.
Okay.
You are not part of any of them.
Okay.
Yes. So your regulation is more to do with the DBS. Okay.
Okay.
And then also maybe part of the junior. You don't really have a regulatory organization that seeks to regulate healthcare professionals. The only concern, if there's anything that has against you, probably is the DBS.
Okay.
You understand?
Yes, I do.
Which cut across both doctors, nurses, and then healthcarers. So
Okay.
healthcarers necessarily do not have or do not fall, but you can be part of a union, okay?
Okay.
You can be part of a union, which I would advise as time goes on. You can join the labor union or the RCN,
Okay.
Royal College of Nursing.
Yeah.
They regulate so that you can be protected when there are any issues against you.
Okay.
All right?
All right.
All right. So the GMC's code, Good Medical Practice, sets the standards for doctors in the UK, outline the principles and values in which good practice is founded. Very important. The MSC's, which is more nursing, provides a framework for nursing and midwifery practice, promoting high standards of care and professional behavior. Okay?
Yes.
But if you realize, it looks like most of the thing that regulates nurses also regulates healthcare, isn't it? It's the same. It's the same code of practice, isn't it?
Yes.
Because you work hand in hand.
Absolutely.
So it's the same. Okay, so the regulatory environment also encompasses mechanisms for quality assurance and continuous improvement. This include clinical audits, where clinical audits, one of those is what CQC does, okay? They come and ensure that the company or care home or hospital is complying with health and safety modalities and formalities, making sure food hygiene processes are adhered, making sure. So all these things falls under. It's a clinical audit. Regular audits help to monitor the quality of care provided and identify areas for improvement. Now, what CQC does normally, if you realize that anytime there's going to be a CQC visit, your managers or they are very, very strict. I don't know if you've taken notice. They would always tell
They
you to
would
do it
ensure
right.
compliance and keep everybody on their toes.
Exactly.
Things do that,
So far in advance, they make sure put everybody, making sure that people, you know what I mean?
Yeah.
Those are yes. So because when they come and they have concerns, they would not give you a good report. In fact, the word is area of improvement. They will state where you need improvement, and they will not give you a benefit. They don't give you a good remarks. It won't help you as an organization. Okay, you can have a good rating, excellent, outstanding rating, or a poor rating, which is not good. And once you have a poor rating, it can lead into shutting down of your care home. Okay.
Organization.
Yeah. Then we have the patient feedback and complaints mechanism. These systems allow service users to provide feedback on their care, ensuring the same like person-centered care. Okay.
Yes.
All right. Very, very important. And then the ethical considerations play critical role in regulatory environment, guiding the behavior of professionals and delivery of care. Same as we know. Then we can look into what we call the autonomy. Autonomy representing the rights of individuals to make informed, we've spoken about it, haven't we? Okay.
Yes, we have.
Yes. Beneficiaries and non, ensuring that actions are taken to benefit patients and to avoid causing harm. Same as person-centered care.
Yeah.
Then justice, promoting fairness and equality in the provision of health and social care services. Very, very important. Equality plays a major role. And that's why we talk about the Equality Act 2010. Okay.
Yeah.
So in conclusion, we can say that understand the regulatory environment for health and social care is essential for ensuring that services are delivered safely, effectively, and ethically. I agree. Okay. The combination of legislative frameworks, regulatory bodies, professional standards, and quality assurance mechanisms and ethical principles provides a comprehensive system that protects both the service users and the providers. Do you agree that it's not only provide a service, but also you, isn't it?
Yes, absolutely.
Also you, because it covers you, because I mean, once you are doing the right thing and you are ensuring that everything you are doing complies with what the patient wants, which normally will be in the care plan, isn't it?
Yeah.
Then you know you are safe from any issues that will be raised against you. Okay.
Mm.
All right. So let's go proceed further. Now in the UK, adult care is governed by the comprehensive framework of legislation and statutory requirements designed to ensure high standards of care, equality, safety, and protection of service users. This framework includes multiple key principles of legislation and regulatory guidelines that establish the obligations and standards for care providers. Good. Health and Safety Care Act 2028. It established the fundamental standards that providers must meet, defines the responsibility of Care Quality Commission in monitoring and inspecting services. Very, very important. The Equality Act 2020, I mentioned about that. That creates a level playing field for fairness against racism, against harassment, and against victimization. Okay. What do you understand by victimization?
Victimization. When you victimize someone, what does that mean? Maybe someone, okay, let me just use an example to let you know what I understand by victimization. Maybe somebody complains, maybe reports you for something you have done. And because you know that you have been reported by this person, you stop being friendly to the person, you take off privileges just because this person has reported an ill treatment. I don't know if I'm making sense
Yes.
to you. So you victimize the person for speaking up, or
100%. You are spot on. Exactly. That's victimization. So discrimination, harassment, and three different things. Okay.
yeah.
So you are victimizing them because of certain concerns they raise. Okay.
Mm.
Yes, and therefore you are not being fair because probably they raise concerns, or maybe a union that raise concerns, somebody is part of a union and also an employee, and they raise concern against the employer, and because of that, trying to victimize them because of that. So that's victimization. Yeah,
Okay.
different from harassment, different from discrimination. Okay.
Yes.
Okay. Now, Care Act 2014, it sets out the responsibility of local authorities in assessing and meeting the care needs of adults. Emphasizes the promotion of individual well-being and integration of care and support services. Very, very important. The Care Act 2014. We need to take note of this.
Okay.
The Care Quality Commission, CQC, we all know.
Yeah.
Its fundamental standard is to create minimum standard below which care must never fall. Key lines of care must never fall. It means that they have to make sure care is always on its top level.
Mm.
Okay, yes.
Yeah.
Then we have key lines of inquiry, KLOs. This framework is used by CQC to assess care services across 5 domains: safe, effective caring, responsive care, and well-led care. Responsive care, very important. A care that is responsive is a care that allows us the same way feedback should be taken from the service users and also from even the staff themselves to help in improvement of care. Then we have safeguarding legislation that seeks to protect adults mixed from abuse and neglect.
Mm.
Establish the duty of care providers to report and act on safeguarding concerns. I will not say only adults, we can also add children, isn't it?
Yes.
So not only adults, because there are people who take off children as well, isn't it?
Mm-hmm.
So protect adults and children from abuse and neglect. And establish the duty of care providers to report, very, very important, and act on safeguarding concerns when they are being reported. Then let's look at this health and safety at work legislation, normally 1974. Now, it ensures the safety of both service users and the staff within the care setting. It requires risk assessment, training, adherence to health and safety protocols. So do you understand the reason why every employer would have to still train or give them mandatory care trainings before they allow them to work?
Yes.
Very important. Yeah. You might even still be a nurse from Nigeria or Ghana, but you still need to have your mandatory training, isn't it?
Yes.
And for that matter, and even sometimes you have to do you should have even done your care certificate training before you even do the mandatory. Where the care certificate has a 15 models approved for those of you who came from Nigeria and are skilled worker. One of the pre-requirement is that you need to have your care certificates, isn't it? Before you can even get a visa. Am I right?
Yes, you're right.
Good. And when you arrive here, your employer must do what give you them. Sometimes they will still do the care training and also give you a mandatory training.
Yes.
Very, very important. This is to ensure that you are
up to date.
Up to date, exactly. Because health and safety is very key when it comes to okay. Then you have the fit for proper person requirements. Okay, it mandates that individuals in key positions within the care organizations are suitable for their roles. And it boils down to the same thing we are talking about. Okay, suitable for their roles. Their trainees, fit for purpose, got all the trainings, they've got all the necessary certifications and all that. In fact, those who work in hospitals, for that matter, NHS, you do, in addition, you do what we call clinical immunizations, medication, okay? For care homes, it's not really important. But those who work in hospitals, in addition to everything, you also have immunization, okay?
Yeah.
They need to see your yellow fever, they need to see
your vaccination records.
All that, yeah. While the care home is very silent on that, it's not too important and relevant. The hospitals, they need to see all that. Okay?
Yes.
All right. Now, mental health legislation. Mental Health Act 1983, amended 2027, governs the treatment of individuals with mental health conditions. The Mental Act 2025 provides a framework for making decisions on behalf of individuals who lack the capacity to do so themselves. That's true. The liberty protection safeguards ensure that any deprivation of liberty for individuals who lack capacity is done lawfully and within their best interest. So even that, it still needs to be done in their best interest, even if they cannot speak. Okay.
Yes.
Or they lack capacity, it should be done in their best interest. And normally, the care plan would stipulate, isn't it?
Yes, it should.
Their best interest, because by then there would have been risk assessment, isn't it?
Yes.
That would have said what the patient like and doesn't like through his power of attorney or his next of kin. Okay.
Yeah.
And then all this.
Please, can you take me through what you mean by power of attorney?
So power of attorney, normally, okay, so let me give an example. You find yourself in the UK now, isn't it?
Yes.
Okay. And so because you are in the UK and you are not in Nigeria at present,
yeah,
there are a lot of things that you cannot go to Nigeria physically to do. Okay. Because your urgency, you cannot, and all that. So you can do what we call power of attorney. All right.
Okay.
By delegating your power to a brother or a sister or a close friend and stating that I, Olufemino, declare legally by court, that in my absence in Nigeria, I am exactly.
Right. Okay, I understand that now. Exactly. Thank you.
The same way, those who lack capacity.
Yeah.
All right. Blind person, deaf person, all those ones, okay?
People with serious mental health challenges.
Because they lack capacity and all that. But they may have definitely a next of kin, won't they?
Yeah, the real.
Or close friend or a brother, they live together, who knows them better, isn't it?
Parents also, yeah.
Before their ailment started, or parent, exactly. So normally, care plans will always have next of kin or a power of attorney.
Oh, I see.
That person is the one who made decisions, isn't it? For the
Yeah.
person, exactly.
Yes. Okay.
All
Thank you.
right.
Thank
Yes.
you.
So in the care plan, normally, if such situation, you always see such a thing, power of attorney or next of kin. It tells you that if there's anything of concern, this is the person you have to contact.
For decisions, okay.
Exactly. So, for instance, if you are working alone, normally in living care kind of where you work alone with patients and nobody is there.
Yeah.
Normally, when you have the number of the power of attorney in the care plan
Okay.
or the next of kin, you understand me?
Yeah.
And if you have anything, any concern, sometimes the patient becomes very aggressive for whatever, they know how to calm the person down. Sometimes you have to call them, okay?
Okay.
Not even your office, you understand?
Okay.
Not your office, it's the person you have to call and they may pass by. Any decision making, shopping, and all those things, they have the power of attorney, all right?
Yes.
You understand?
Yes, I do. Thank you.
You're welcome. And then code of practice sets out professional standards for care workers and organizations. It includes guidance on ethical behavior, quality of care, and professional conduct. So let's move on. So in conclusion, we can say that the regulatory environment for adult care in UK is designed to ensure the highest standard of care through a robust framework of legislation and statutory requirements. Very important. But adhering to these laws and regulations, care providers can ensure the safety, dignity, and well-being of individuals, don't we?
Yes.
Amazing, amazing. So let's look a bit of analyzing of the organizational systems. Ensuring compliance with regulatory requirements in health and social care organizations involves a structured approach. These mechanisms are designed to maintain high standard of care and safeguard. One of it is, first of all, the quality measures. Systems for monitoring and improving the quality of care. Very, very important. Systems for monitoring and improving quality of care. One of the systems that we use in monitoring and improving, I would say, is handover notes. Isn't it?
Yes.
Because in handover notes, the morning shift person will definitely put some notes there, isn't it?
Yeah.
And inform you what happened during the day, isn't it?
Yes.
And because you are the afternoon person, you are new, you could not tell the behavior of that person during the morning.
Yeah.
So it helps to monitor and guide us. So the morning shift person can say, oh, this patient during this time this morning was very aggressive, maybe he lost a family member, you know what I mean?
Yes.
And therefore, it informs you, the afternoon shift person, you know how to go about the patient. Exactly. They would have told you that he's not eating the whole day, isn't it?
Yeah.
Exactly. So I believe handover notes is a system that helps in monitoring and improving quality of care, isn't it?
Yes, it does.
Exactly. Okay. Example, clinical audit, performance indicators, benchmarking, and about handover for me, it's a key thing. It's a key thing. Care plan would also show you some things about the person as well. Okay. Right. Feedback systems, also same. Mechanisms for collecting and responding to feedback from service users and staff. Example, surveys, suggestion boxes, complaint procedure. Again, for me, handover notes also play a major role also in the feedback, okay? Because morning person will tell you, evening person will tell you also the feedback they got during their shift as well. Okay.
Yes.
In some places they have suggestion box, you know that.
Yes.
Where you can put yours in the suggestion. So all those are there. All those are there. And then regular meetings once a while, okay?
Yeah.
Regular meetings once a while. I mean, every month, if a carers within the part, if there are 4 people who take care of one particular care, just service users, maybe one that's morning, evening. It's good once a month you can meet to have discussion about the patient, isn't it?
Yeah.
Yes. All right. Then
Yes.
policy reviews, regular assessment and updating of organizational policies to reflect current regulations and best practice. Exactly what I said. Okay.
Yeah.
Regular assessment, update organization policies is to and best practices. Example, annual reviews, appraisals, consultation with stakeholders, incorporation of new legislations and all that. Okay, audit, systemic review of organizational practices to ensure adherence to regulatory standards. Example, internal audits, we all know internal audits.
Yes.
External audits and compliance checks. Internally is normally done by the staff by the company themselves. But you may have the external one that is CQC and other organizations, okay? And you have the compliance checks, which is more to do with the compliance checks, ensuring that staffs and managers are complying to regulatory frameworks and legislation, okay?
Yeah.
For example, you could, Rido or Kosh, you know about Kosh and Rido?
Yeah.
Exactly. So are your staffs wearing aprons, okay? When they are going to a patient that has certain things that needs apron, ailment that needs apron, a staff with an HIV AIDS, okay?
Yes.
All those things, it may be confidential, but the staff
yeah,
you'll be informed. So you need to put your apron, you need to put your nose mask, isn't it?
The entire PPE.
Thank you. Thank you. So there should be ways to check that those compliances are being adhered with, okay?
Yes.
Your gloves when you are doing personal care and all those things need to be in place. Action research, and an iterative process of problem solving aimed at improving practices through active participation and feedback. Active participation, the same thing, it's just the same thing. Participating actively in is the same thing that we're talking about. Example, pilot projects, continuous improvement of initiative, collaborative research with academic institutions. Okay, who is a registered manager?
Are you asking me or you want?
Yes, please.
Okay. I think the registered manager is the one who is at the helm of affairs in the care home. And this is someone who has passed the CQC requirements for somebody who is eligible to oversee the activities in a care organization, not even a care home only, in a care setting, basically. So the person leads, guides, sets, what's that English now? It's just the person in charge of affairs of the organization, basically.
So I think you beautifully said it. And one key thing that I wanted to hear from you is the one CQC have approved. That's the most important. Okay.
Yes.
That's all about registered manager. CQC requirement requires that there should be a registered manager for every care home or supported living across. Okay. You said the care setting. Okay.
Yes.
So the registered manager is the one CQC have regulated and confirmed by his qualification or a qualification. Okay.
Right.
Which is normally a level 5 leadership and management. Okay.
Yes.
You should have so that's the registered manager. He has the oversight responsibility of the care home. He helps in policies, okay, and all those in the care home. And then who is a nominated manager or nominated individual?
I'm not sure before now, but
okay. So let me explain. Whilst the registered manager is the one who is approved by the CQC, okay?
Yes.
When a company is applying for CQC license, you need to add in addition a registered manager, okay? Who must have a requirement by law to meet the CQC. In fact, you do what we call a DBS for those persons differently.
Okay.
But having had a registered manager, the company or the registered manager can appoint another manager who is not part of CQC, who is called a nominated manager. The word is nominated or dedicated. You understand the difference?
Oh, yes.
So more of like your deputy, okay?
Okay.
But he is not on record when it comes to CQC inspection.
Okay.
You understand?
Okay.
CQC can only hold the registered manager liable. You understand me?
For any mishap, but not the
nominated. Not the nominated. But the nominated is appointed. So because the workload is huge. Okay. So you have to act. So he acts on behalf of the registered manager. Have you seen that?
Yes.
So he can do many things on behalf of the registered manager when the manager is not around. So he's called nominated individual.
So if one is applying to a job to deputize as for the registered manager, is it a role in itself? As in, is that a name? You want to go to Indeed? Can you go and type in nominated individual as a role?
I would say
engine?
not really.
Because
It's a
I've not
rule.
heard that before.
Yeah, no, it's internally. It's internal,
Okay, so
not
such
really
a
out there.
person, okay, sorry. So such a person is going to be applying as what?
No, you don't apply us as nominated manager. Normally, it is no more. It's done internally. Normally, it should be
Okay,
somebody who's already working. You understand?
all right.
Normally working within the organization
Okay,
for which you have lot of experience, and then they can appoint him or nominate him as a nominated
okay,
manager or as a, let me say, deputy registered manager. Okay.
okay,
But you may have advert where you can see a deputy registered manager is also there.
okay.
But not
Yes,
then, you understand? Not then,
yes,
you may have adverts like that. Or
yes.
indeed, if you Google, you might see things like that where they need a deputy manager or deputy registered manager is also there.
Okay,
It's also there.
okay.
You understand?
Oh, thank you.
But the nominated manager does similar role, just like a deputy manager.
Okay,
All right.
okay.
Yeah. It may even be that the nominated manager is even more experienced than even the registered manager. You
Manager,
understand?
right.
It may be even more experienced, okay,
Okay,
than even the registered manager. But he's nominated, so he's not on record with CQC, okay?
okay. I see the difference. Thank you.
You're welcome. Then we're talking about the conclusion and all we said. Then we go further to look into the types of inspection that CQC does. We have the comprehensive inspections, detailed reviews of an organization's overall performance across all services.
Mm.
Focused inspections, targeted reviews based on specific concerns or areas of improvement. You understand?
Yes.
The comprehensive is overall, but then the targeted, probably they came the first time overall, and then they saw areas of improvement. So the next time when they are coming, they are looking at those particular areas of improvement, isn't it?
Yes.
Then we have the thematic inspection. Those are reviews focused on particular teams or issues across the multiple organization.
Mm.
Okay. Then let's look at the report outcomes and implications. Ratings, I spoke about that, didn't I?
Yes, you
I
did.
said that the CQC can either be outstanding, good, or requires improvement, isn't it?
Or inadequate.
And this is why most care homes don't want, okay?
Mm.
Because those will be on the internet, everybody will see it, okay?
Yeah.
So they wouldn't want anything bad, and that's why you have to put you guys on your toes.
Yes.
Findings, detailed feedback on strengths and areas needing improvement, okay?
Yes.
Then they can recommend suggestion action to address those definite areas, isn't it?
Yes.
So let's look at potential enforcement actions. Warning notices as well.
Mm.
Formal notices require improvement with a set. This is when they move to the next stage, okay? That continuously they raise concerns and continuously nothing is changing, isn't it?
Yeah.
Then they can give you warning.
Warnings.
Yes. Then those warnings can lead to fines,
Mm.
financial penalties for non-compliance, isn't it?
Yes.
Okay. If your employer by law, your employer is meant to be paying your pension, isn't it?
Yes.
So if the pension regulator finds out that your employer is not paying, what can they do?
Mm. I'm
They
not
can
sure.
find them,
Mm.
can they?
Okay.
Exactly. All right.
Okay.
So if it's reported that your employer is not paying your pension
Yeah.
and they wrote your employer severally and your employer is not changing, they can find them. Okay.
Okay.
Am I making some points?
Yes, you are absolutely.
Then we have service restrictions. They can also limit your service. They can
Mm.
put you on hold until you solve that, isn't it?
Yes.
Exactly. Then closure. That's what you don't like. You wouldn't want to, isn't it?
There are cases.
Exactly. But once there's a closure, all of no work, frustration, people are going to. It's a lot of things.
Mm.
Okay. Any question?
So far, we're good.
Okay. So let's look at service information requirements. Public availability. Information about the service must be accessible to the public, often via website or public records. Very, very important.
Mm.
Able to access everything about CQC and other organizations on their website. It should be easy. There should be transparency, detailed about service performance, inspection reports. Compliance must be clear and transparent. That's what I'm saying, that if there's any rating about you, it will be put out there, okay?
Yes.
Reporting obligations, regular reporting to regulatory bodies or key performance indicators and compliance status. Of course, you need to be making sure that you are compliant with CQC, regular reporting, documentation, and all the filing of documents. You need to comply every now and then. Okay.
Yeah.
CQC inspections. Organizations must comply with CQC regular framework, including inspections, reporting, and improvement actions. Very, very, very important. Very, very important. You have to comply. Local authority oversight, what we call the councils. The local authorities may have additional requirements and oversight responsibility for care services within the jurisdiction. Yes, of course, they also have their role to play. Okay.
Yes.
Because the local authority also have safeguarding teams. Okay. And all that. So if there's a referral that is made with the safeguarding, the local is not about CQC, it's more local. You have to send safeguarding team to come and do inspection, and they can also recommend closure of your care home.
Okay. So sorry, can I ask a question there?
Go ahead.
So if there's a safeguarding concern raised in a care home, who handles it first? Is it the local authority before going to CQC, or it's the other way around?
If it's about safeguarding, it goes to the local authority.
Okay.
CQC is more to do with the health and safety and requirement of the build, you know what I mean, the policies.
Okay.
You understand me?
Okay.
But if there's normally, even if you report to the CQC, they might sometimes also refer it to the local authorities.
Authority. Okay.
Yes.
Okay.
You
So
understand me?
as a relative of a service user, you have come to the maybe supported living facility, and then you see that some things are not right. As a relative now, not as a professional,
Okay.
I'm supposed to go to the local authority to present my report.
Yes. But you know, by law, you cannot just go, you have to report to the care home first.
Okay.
For them to investigate. You cannot just see
Go
something
on.
and then externally go and report it. You understand?
Okay.
If a relative have any safeguarding concern concerning their brother or sister,
Yeah.
you need to raise it to the care home first. Okay.
Okay.
So the care home may also have their safeguarding team. They may have some manager in charge of that. So you have to raise your complaints within
Internally first.
Exactly. And then and they'll deal with it.
Okay.
Sometimes it may be even your local managers who might even refer the issue. For instance, a common have the right to refer you, the staff, to DBS. You know that.
Right.
Yes. If they investigate something and they find you wanting and palpable, and that you neglect your duty, and therefore it's a great concern, they can refer you to the DBS.
Wow.
Yes, it's a big issue.
Okay.
The same with nurses as well. Nurses, NMC, because they cannot refer you a carer to NMC.
Okay.
Because the MSC does not regulate carers, okay?
Yeah.
But they can refer you to DBS and say, we feel that this woman or this man is not fit for purpose, fit for practice, okay?
Okay.
He has caused people to fall down and all that. He's neglected his duty, and we feel that we need to investigate this for us.
Right.
You understand?
Yes, I do.
Aha. And the local authorities, safeguard local authorities, you have a lot of them in Manchester, wherever you are in Kent. So that is how it works. No
Sorry,
relative.
Sir, can you give me 30 seconds? I need to attend to my child. 30 seconds, please.
Okay.
Papi, what do you want? I'm so sorry, I'm back. Thank you.
No problem. So there are policies for every home. If there is any, unless you are doing a whistleblower, reporting something that you feel that is happening in the care home that is continuing happening, you are reporting it secretly out there for them to investigate.
Okay.
But if you have a genuine concern, if you have a relative or something there and you will or you've noticed safeguarding concerns, you need to report it. Okay.
Okay.
Internally first, raise your concern first. They will look into it.
Okay.
And address the issue. Okay.
All right. Thank you.
Where they need to sack someone, they do and all that. There have been many allegations within the care home, but you have to investigate it first.
Okay.
If up to that, when you report something and you feel continuously nothing is changing and it's happening, then you can go external. You understand?
Okay.
Okay.
All right.
Then we have action plans and training and development. Okay. Action plans, development, implementation, and monitoring. We mentioned about this already. Okay.
Yeah.
The training and development, staff training, very important. We spoke about that. Policy updates, we spoke about that. That the trainings helps to give you or get you abreast with policy update and new ways of doing things and all that. Okay.
Yes.
Continuous improvement. We spoke about the establishing continuous improvement programs to regularly assess and enhance service quality. Feedback integration. Using feedback from inspections and service users to inform and drive quality improvement efforts. Very, very important. Conclusion, health and social care organizations must respond proactively to inspection requirements to maintain compliance and enhance service quality. This involves understanding and meeting various inspection processes and requirements, being transparent about service performance, and implementing robust action. Through continuous monitoring, staff training, and quality improvement initiatives, organizations can ensure they not only meet but exceed regulatory standards, thereby safeguarding the well-being of their service users. Very, very, very important. References, you can find them on your model, okay?
Okay.
You can find them. We use the Harvard style of reference. I hope you know that.
Say that again, please.
The Harvard style of reference, that's what we use.
Okay.
The Harvard style of references.
Okay.
That's what we use, okay? So in your assignment, and if you want to quote any reference, it should be the hazard type of reference. Okay?
Yes.
Then for every lecture, within 2 weeks, we expect that learners should be able to start submitting the assignment. Okay?
Okay, so does it mean 2 weeks from today?
Yes, so you can start, but then we would, by then, before you complete all the units, you should be on your way running up. Okay?
Okay.
So if you go to your model, every lecture has some kind of questions. Okay?
Okay.
But the lecture itself, I think we have 4 models, isn't it? To go 4 models. So
yeah,
by the time we finish the model for the unit, okay, you should be able to start running up. Okay, that'll be the last one. Yeah. So every lecture, my advice you just start looking into the questions and start addressing them. Okay.
Okay, so now today, after this learning outcome 1, the assignment under it, I can commence doing them.
Yes, you can commence instead of waiting for the whole
okay,
the whole module to complete.
And I realized we are having like an assignment meeting or something.
Yes, we'll have, that's the final bit. When we finish the final lecture, LO4, there'll be one day another lecture again for assignment discussion.
Okay, so you shouldn't submit before the, of course.
No.
Before this discussion takes place.
Exactly. We're gonna have assignment discussion.
Okay, then is it possible that one has access to a previously submitted assignment just to see what it looks like?
We don't tend to do that anymore.
Okay.
But I'll check. You can email, just email the admin team.
All right. So that serves as a guide.
That'll be a problem. Yes.
Okay.
I don't think it's a problem. You just email the admin team, okay?
Okay.
And they should be able to help you on that.
Okay, thank you.
And now I'll need you now. Make the responders, if they get sponsorship, make I know now, make I help some people.
Okay.
Where you did, if they get this thing, make I know.
Hello.
Yes, can you hear me?
I can hear you, but I lost you for a few moments.
Yeah. I said we brought the lectures to an end.
Okay, thank you.
But where they talk say if they get sponsorship this thing, make I know, make I help some people, some relatives.
Okay.
Yeah.
Okay, no problems.
You go feel message me, you get my number. If
yes,
in the group, I go message you different, okay?
Okay, no wahala.
All right. Thank you. All the best.
Thank you. Bye. Yes, Papi. Come.